The COVID-19 pandemic continues to manifest its presence in the Gambia as the death toll hits 23. The World Health Organization vows to end the COVID-19 pandemic as the virus continues to cause havoc. And the Kenyan aviation industry struggled to survive amidst the impact of the COVID-19. This and more coming on The World today. Hello there, this is Africa TV and you are watching the World Today News Bulletin. I am Amadou Kante. Many thanks for joining us, and now the news in detail. Now, Gambia continues to battle against the COVID-19 pandemic as the number of cases continue to increase on a daily basis since early July. On Sunday, the Ministry of Health announced more than 100 fresh cases of the novel coronavirus and 4 related deaths of COVID-19, bringing the total number of deaths to 23. The CISE has more in this report.
The Gambia has registered an additional 4 COVID-19 related deaths, 145 new cases, and 75 new recoveries as of Friday. This brings the overall death toll to 23. 1,235 confirmed cases, 221 recoveries since the confirmation of the first case in the country, early March. As indicated in the 114 National Situation Report on Sunday, 36% of the new cases are Medical Research Council staff and their close contacts. These constitute a 43% positive test rate, 145 out of 339 total tests performed. The report further stated that, unlike the previous set of reported cases, which were predominantly asymptomatic, over 40% of the new cases are symptomatic, with many presenting loss of taste or smell and intermittent coughing. By the latest report, 339 new laboratory test results were received from Medical Research Council and National Public Health Laboratory, and of this, 22 returned indeterminate and 145 newly tested positive for COVID-19. 24 people were newly taken into quarantine, 75 new discharges were made. The country currently has 339 people in quarantine, 991 active cases, 134 probable cases, and a crit case fatality ratio of 1.2%. Since the outbreak of COVID-19 in the Gambia, the country, together with partners, have been working tirelessly to control the spread of the virus. However, the country has seen over a 70% rise in the coronavirus cases last week, prompting the government to take further measures to curb the spread of the virus. This includes the closure of markets at 2 p.m. and fumigation of the markets every Sunday, avoid the potential risk of contaminating the public space. For iAfrica TV News, Ndesisi.
The COVID-19 cases continue to spread in the Gambia as the country registered more than 1,000 cases now. Now, from the report next, we head to Nigeria because one of Nigeria's major cities, Lagos, has allowed residents to revisit their worship places more than 4 months after absence thanks to the COVID-19 global pandemic. Worshippers expressed delight for returning to the worship centers as authorities put in place safety guidelines to protect people contracting the virus. The Nigerian government had ordered the closure of all public places, including religious centers, as part of measures to stem the spread of the disease in the country. Here's more details of that.
Getting screens to gain access to the mosque for prayers. It's a new normal for houses of worship in Lagos, and it doesn't end here. Every worshipper is still required to write down their names and giving a tag before they are finally allowed in. And once the number required is complete, the gates are shut. Inside, everyone must observe physical distancing and have their face mask on in line with the guidelines issued by the government of the city. It's the very first time this mosque will be reopening for worshippers in nearly 5 months after the government shut down all worship places in the city to check the spread of COVID-19.
Even the mosque itself took so many measures. Like sanitizing of the mosque, it was done. I think twice, we did it twice. The sanitizing of the people that will come to worship, we make sure the waters are running, not inside the mosque and even outside the mosque. We have soap to wash their hands so that they are coming from outside. They might be contaminated with so many things. Their hands are washed. And we are taking records in case we have an issue so that easy contact and contact tracing can be made.
The turnout is very, very impressive. And on the part of the restriction, of course, we have to start from somewhere. We have to start. This is more or less like a litmus test. And of course, we are good to go.
For many worshippers, the reopening of religious centers is a welcome relief and gives them the opportunity to also meet with friends they have not set their eyes on since the COVID-19 induced restrictions were imposed.
It feels so good. For the past 4 months, we've not been to mosques. We have little prayers. We do prayer around 12, 1. We couldn't do all that. But now that the mosque is open, we are so grateful to Allah that at last it is open. We can gather and pray Jumat. Alhamdulillah.
Authorities say this is only just a test to assess the readiness of the worship centers to comply with the COVID-19 guidelines. For now, both mosques and churches are only allowed to hold services once a week until when the government feels it has the COVID-19 situation very much under control to allow for full-blown operations of worship places.
And from the report there in Lagos, Nigeria, we head to matters of the WHO because the World Health Organization confirmed that there are about 20 million confirmed cases of the coronavirus. These statistics covered 213 countries worldwide. The health organization made this revelation in a press briefing on Monday. More details of that in this report by Aissatou Tamba.
The World Health Organization has revealed that 750,000 COVID-19 related deaths have been recorded globally. They revealed that nearly 20 million cases were confirmed and 12,914,295 recovered globally. Speaking during a press conference on Monday, WHO Director General said the pandemic has affected 213 countries and terrorized around the world. Dr. Tedros said WHO is doing everything humanly possible to put an end to the pandemic that is wrecking the world. He urges government to follow the preventive measure to suppress the virus.
And a comprehensive framework for allocating these scarce tools for greatest global impact is under consultation. The coming 3 months present a crucial window of opportunity to scale up the work of the ACT Accelerator for global impact.
Dr. Tedros said there still exists a huge global gap on the ACT Accelerator. and the fund that has been committed to fighting the pandemic. WHO Director General said over $100 million will be needed for the vaccine alone.
For the vaccines alone, over 100 billion will be needed, US dollars. This sounds like a lot of money, and it is. But it is small in comparison to the $10 trillion that have already been invested by G20 countries in fiscal stimulus to deal with the consequences of the pandemic so far.
The World Health Organization and partners will support in acquiring protective equipment for frontline health workers. He said the World Health Organization is committed to equipping diagnosis laboratories and improve surveillance and data collection, all gained towards fighting the global. Reporting for iAfrica News, I am Aissatou Tamba.
The World Health Organization reiterates commitment to eradicate or eliminate the COVID-19 pandemic. And from that report there, we will now take a break and come back shortly with the remaining update stories. Stay with us, we'll be right back.
Debunking COVID-19 myths. Myth 1.
Mi wulnani corona de. Alangata balenyo.
Alade corona anda lenyo, corona anda lady, corona anda sare, corona ko fof jaggato anda balejo anda bodejo. Ayande lede de kertuden fof no jogi corona. Gambia ko hen tawa.
Myth 2.
Aha. Hana ko gonga nyamugol laaj e renite coronavirus.
Alade nyamugol laaj renata mo wana gonga. Continent ko woni gonga kon continent loten juude men dem diam e sabunde accite 1 meter distance hakkunde meden continent sartaji be wi pour renen hore men renen yimbe be.
Myth 3.
Aha ang ado andi Gambia tawaka coronavirus wata wurude e nguleke.
Alade corona wura e nguleki, corona wura e bubol. Ayande ledi de kertude fo no jogi corona continent loten juude men den e sabunde waren nyaw o ka juude meden te waten memu gite meden kinede e hunduko ko sabunade corona ko do wallirta.
Myth 4.
Mawbe andane corona ko tufunde tunno woni ala ko dore
alade corona na ka dore dulaji gono do tunduji gono do be jogi cases ji corona wana ka tufunde tun wodi de anda ande ron dum non.
Welcome back, and you're watching the World Today News Bulletin on iAfrica TV. And now to the rest of the stories. Now, Brikama Area Council has joined the fray in the fight against the COVID-19 pandemic in a fumigation exercise at the Olyundu Market amid the spread of the novel coronavirus in the region. Markets were closed on Sunday for cleansing exercise as part of measures to curtail the spread of the disease in the country. Makalo has more in this report.
The Brikama Area Council recently conducted a fumigation exercise at the Olyundu Market to help contain the spread of the coronavirus in West Coast region. The fumigation exercise is also part of the new COVID-19 regulations that states that all markets and shopping areas in the country should be closed on Sundays for cleansing and fumigation by municipal councils. 7 teams from different institutions participated in the fumigation exercise. The Council's Chief Operation Officer Safar Sane said fighting against the pandemic should be a priority to every administrative area council.
this COVID-19, we should all come together, we fight for this disease. And the Brikama Area Council cannot behind to fight this disease. Because all the market they are on the Brikama Area Council. We are the biggest council at Gambia. We will make sure that every place people are doing business there, we will come and spread all the market.
The fumigation is also done in other markets that fall under the catchment area of Brikama Area Council. Mr. Sane appealed to market vendors to adhere to the precautionary measures to make the fight against COVID-19 a success.
We are urging the people of the market, they make sure that everybody should have a water at your shop place or you have a sanitizer so that everybody can use it. Because this disease, COVID-19, everybody should know that it's a fight disease. All should come together, we make sure we fight it.
The Gambia has registered an additional 4 COVID-19 related deaths, 145 new cases and 75 new recoveries as of Friday. This brings the total death toll to 23, 1,235 confirmed cases and 221 recoveries since the confirmation of the first case in the country early March. For iAfrica TV News, Awa Makalo.
And from the report there by our Makalo, next we head to Kenya because the Kenyan aviation sector continues to face with business challenges amid the impact of the coronavirus pandemic. Despite resuming international flight operations, the country's airline is projecting about $400 million losses in revenue by the end of the year. Experts say government support is needed to save the industry. Let's have more details of that in this report.
As the first Kenya Airways flight from Kigali began its descent into Nairobi after almost 4 months following the outbreak of COVID-19, it was half full. The impact COVID-19's had on the airline became more apparent as it taxied to the apron. Dozens of KQ planes remained grounded. For many of the passengers, they were just glad to be home.
This is awesome. This is awesome. We've been waiting for this.
The captain of the flight, however, was more reflective.
Hopefully, we'll increase our frequency depending on the passenger numbers that come on board.
Like all airlines globally, Kenya Airways been pushed to the brink by the pandemic. Before COVID-19, the airline was flying to 55 destinations globally, carrying 4 million passengers annually. Since resuming international flights, it's now flying to only 30 destinations.
There has been an extremely suppressed demand going forward. If you look at what we have deployed for our frequency and our destination, it is not 50% of what we were flying before.
The current demand is attributed to passengers who were stranded when countries closed their airspace. Largely dependent on holidaymakers and business travelers who've been forced to stay home because of the pandemic, the airline is now scrambling to remain in the skies.
We cannot keep an airline at 100% when the demand is only 50%. And that is why we need to restructure the airline. So restructure just, the assets, restructure the operations itself, how we operate. And then, of course, unfortunately, even for employees. And like you said, it's a very painful thing to do.
The airline projects losses of up to $400 million by the end of 2020. Experts say government support is essential for survival.
We need governments to underwrite loans and to offer state support and to guarantee loans as well and to reduce taxes. Those are the big things. And most governments in Africa are just not doing it. And the bottom line here is that over $30 billion was promised by governments in Africa to support the airline industry. And only $311 million of that amount has been paid out.
Kenya Airways is in the process of being nationalized, and when the turbulence in the industry finally settles, the airline will be hoping this greeting
"Welcome on board Kenya Airways"
will continue to welcome passengers on board their planes for years to come.
And from the report there in Nairobi, Kenya, finally to South Africa, because South African telecom operator Rain has partnered with Chinese technology giant Huawei to launch the first standalone 5G network in Africa. The new 5G network is expected to provide fast and efficient service delivery to boost production. The Chinese network company is providing both standalone and standalone 5G in South Africa. Let's have more details of that in this report.
Chinese tech giant Huawei partnered with South African telecom operator Rain to roll out the first standalone 5G network in Africa.
What we're seeing in African markets is a strengthening of the relationship between Huawei and local telcos, partly as a result of resistance to American efforts to control global commercial activity. Right now, we're seeing at least 3 of the major operators having rolled out 5G infrastructure, but at this stage, it is only limited to certain urban areas.
Huawei is currently offering both standalone and non-standalone 5G. A standalone network is faster but more expensive because it needs its own infrastructure. Currently, Cape Town has the only standalone tower through Rain, but 5G is available to the rest of the country via the other networks.
You see this camera right here, it streams at around 11K. And with 5G, needing all that data, at least we can actually do it at low latency. You can actually even conduct a surgery. Students don't have to watch from the window. They can actually see a live view of what exactly is happening.
The opportunities are plenty, especially for small and medium businesses.
If you think about healthcare and education, those are 2 massive impacts. And then job creation on its own, 2.2 million jobs potentially being created by 5G networks, $2.1 trillion in GDP growth. On the healthcare side, having that stable network means that you can have remote sessions with patients. It means that you can have, kind of remote operations.
Another key advantage is efficiency. Sending data from one point to another will be faster and easier, improving productivity. There's no doubt the launch of 5G can help to reduce costs and to create better access to connectivity, important steps towards bridging the digital divide in South Africa.
Chinese company Huawei, they are exploring the African market. And well, viewers, with that report there in South Africa, we finally brings this news bulletin to an end. But for more details on this and other stories, as always, you can log on our website on africa.tv. Once again, many thanks for the pleasure of your company. Thanks for watching. Stay safe and bye for now.